My name is Bill Ooten. I'm the Emergency Management Coordinator and the Director of Emergency Services for Culpeper County. I'm joined this morning by Mr. Gary Deal, the Chairman of the Board of Supervisors for Culpeper County, and Mayor Mike Olinger with the town of Culpeper. Over the last couple of months, our community, just like others all across the world, have been greatly affected by the COVID-19 pandemic. We first learned about COVID-19 virus in December, when the first reports of the outbreak first occurred in China. In January, planning and preparedness efforts had already begun to take place between our local departments and other state agencies and the Virginia Department of Emergency Management and the Virginia Department of Health, in anticipation that this virus could potentially reach the United States. Then, on January 21st, the United States reported its first confirmed case of the virus in Washington State. In early February, our department released the first of many public service announcements regarding the COVID-19 virus to the community via our social media page to share that the planning and preparedness efforts here had already begun locally. By this time, collaborative efforts had already started between our agency, Culpeper Medical Center, the Culpeper Human Services Department, and our Rappahannock-Rapidan Health District. On March 3rd, myself and the Virginia Department of Health conducted a briefing to a number of various county and town departments, elected officials, and other community leaders. Several days later, on March 7th, Virginia reported its first positive case of the COVID-19 virus. By March 10th, the Office of Emergency Services had released an emergency operations plan to all of the supporting public service agencies throughout the county and to the town of Culpeper. That plan addressed our local coordinated response and the actions that should be followed if we were faced with this virus in our own community. And it outlined many of the guidelines and recommendations that had already been released previously by the CDC and the Virginia Department of Health in response to the growing health crisis. The efforts to plan and to prepare our community for this was an all-hands-on-deck operation. And every one of your county and town departments stepped forward and offered their time and devoted their energies into ensuring that our community was prepared as we could be to face this challenge. I cannot thank these local departments and organizations enough for their many long hours and the amount of dedication that they put into ensuring that we were preparing for this in our own community. As the number of cases continued to grow across the country and also in our own state, the governor issued a state of declaration of emergency on March 12th. On March 13th, the President of the United States made a national emergency declaration. As our planning efforts continued locally, I carefully reviewed the data, statistics, and the rate of increase and spread throughout the Commonwealth, then subsequently made the recommendation to the Culpeper County Chairman of the Board Supervisor, Mr. Deal, and on March 17th, a local declaration of emergency was declared in Culpeper County. 2 days later, on March 19th, the Virginia Department of Health reported its first positive case of COVID-19 in Culpeper County. After further information provided by the Virginia Department of Health revealed occurrences of the virus in every region of the Commonwealth and indicated that there was community spread of the virus, the governor's office issued Executive Order Number 53 on March 23rd, placing temporary restrictions on restaurants, recreational, entertainment, gatherings, non-essential retail businesses, and closure of K through 12 schools due to the COVID-19 virus. On March 30th, to further expand upon the efforts to reduce the spread of the disease, the governor's office also issued Executive Order Number 55, a temporary stay-at-home order that placed some provisions on travel outside of the place of residence and further enforced the need for social distancing. Since then, though we continued to see a rise in our local and state cases, there is evidence that these measures are in fact working to slow the actual rate of increase throughout the state and in communities throughout the Commonwealth. Even before and certainly since those orders were issued, our community departments and agencies have been working together to support one another and our community as a whole. With schools closing and realizing the need to assist the critical infrastructure agencies and organizations in Culpeper County, the Culpeper County Public Schools and Culpeper Human Services partnered together to provide child care services to our essential emergency services, law enforcement, and healthcare workers in the community. The Human Services Department has been offering free meals to our school children. Additional resources have been provided to our homeless population. Our volunteer fire and rescue departments continue to offer their services to the community, and some have even opened up their stations to provide additional storage for essential supplies. Our environmental services and parks and recreation personnel are assisting in the receiving of and transporting of additional food supplies. Our public schools provided the electrostatic sprayers and the fluid that our department is utilizing every day to fog and decontaminate our first responder ambulances and our first responder stations so that we can add another layer of protection and prevention for our frontline responders. Those are but a few of the many things that our county and town departments are accomplishing throughout the community. But let's also talk a little bit about the private businesses and the individual citizens that have stepped up and offered their help to the community during this difficult time. The individuals that are using their own money and supplies to make and deliver face masks to first responders, healthcare workers, and whomever needs them. The local distilleries who are producing gallons upon gallons of hand sanitizer. The local restaurants that are offering free meals to our first responders. The neighbors that are making the shopping trips for essential needs and supplies for others so they don't have to go out themselves right now. Our community continues to pull together in many positive ways. But these are difficult times, and we are experiencing things that we have never experienced before in our lifetime. We are being asked to make sacrifices to adjust our way of life. We have made many necessary adjustments to the way in which we live, communicate, work, and even worship. Many of these adjustments have been difficult, and all of us have been asked to make these sacrifices as we try to combat what has clearly been recognized as a very real, and for some, a very lethal disease. A contagious disease that spreads communicably and currently has no vaccine available. You have all been asked to make those sacrifices in order to protect those others that may have a much greater risk of not being able to recover from this disease like some. You have been asked to make those sacrifices so that we can slow the spread and reduce the risk for everyone in our community. Once again, there is evidence to support that the sacrifices that you have all been making is leading to a reduction in the actual rate of increases. There are some models that are even showing that statewide hospital capacities may not even be reached if we continue to abide by the guidance and regulations that we are called to do. I know that there has been much debate and conjecture regarding a number of various topics related to the COVID-19 virus. My position and posture here is not to debate or to deliberate on those various topics. As an emergency manager and as a healthcare provider myself, my position, my priority, and indeed my responsibility is to the health and safety of the citizens of this county first and foremost. When I was a street medic, I was provided with the tools and the medication needed to combat a number of life-threatening conditions in the field. My mission was to preserve and to save lives whenever I had the opportunity. In this particular health crisis, the only tools that we currently have at our disposal are the guidelines from the CDC, the VDH, and the epidemiologist that are recommending that social distancing and limiting the spread of this virus by traveling away from our homes only for essential needs is the only way that we can effectively battle this potentially life-threatening virus. So, I urge each and every one of you to please do your part to protect your community. Do your part to help to continue to slow the spread of this virus. Follow the recommendations, obey the guidelines, lay aside the politics and the partisan stance for right now. Until a viable vaccine can be proven and made readily available to this community, the rate at which the spread of this virus either increases or decreases is entirely up to all of you. God bless all of you, and we will continue to be here for all of you during the duration. Thank you, and I'll turn it over to Mayor Olinger.
Thank you, Bill. Good morning. I am Mike Olinger, Mayor of the town of Culpeper, and I also operate a business in the town of Culpeper. I know this is a very challenging and difficult time that is impacting everyone in our community in some way or another. Our hearts are with those who have lost loved ones as a result of this virus, as well as those with loved ones fighting the virus, and those who have loved ones who are at heightened risk from the virus. I want you to know that our town government is working to support our citizens and local businesses in the following ways: through small business grants, by waiving late fees, and providing adequate PPE supplies for our first responders. We are grateful to all of our community partners who are working hard to keep our community informed with up-to-date information and protecting as much as possible from this virus. We are very fortunate to live in such a caring and loving community and giving community. We are stronger when we stand together. So in the meantime, please continue to practice 2020's new most used phrase, social distancing, wash your hands, and follow the CDC guidelines. We will overcome this together. It will take time, but we will recover. Life will return to normal, and we will be Culpeper strong. Thank you. And I'll turn it over to Gary Deal for the end.
Thank you, Mr. Mayor. Good morning. I'm Gary Deal, Chairman of the Culpeper County Board of Supervisors. Before I share my thoughts today, we lost a special person in our community yesterday, Vince Valla. Vince was a longtime photographer and writer for our Culpeper Star Exponent, a talented musician and singer, and just an overall great person. Culpeper is better for having had Vince Valla in our community. I would like to take a moment of silence for Vince to remember him at this time. Thank you. The mayor and I are here today to support Director Ooten and our emergency management staff and our volunteers. They, along with our healthcare workers and our law enforcement personnel, are placing themselves at risk every day for us, and I consider them heroes in our community. If you and I don't practice the health guidelines that are in place, our actions could not only impact others in the community, but our first responders and healthcare workers as well. So I urge you to please practice these health awareness guidelines. Locally, our COVID-19 positive cases numbers have gone up. Culpeper has gone from 8 cases on April 6th to 20 on April 13th, to 32 on April 17th, to 51 on April 20th, and 65 yesterday. We need to stay focused on these awareness best practices, including stay home as much as possible, especially when you are sick. Practice social distancing. Maintain at least 6 feet of space between yourself and other individuals when you must be out in public. Avoid contact with sick people. Cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. If you are experiencing symptoms, call your doctor. And last on my list, look out for your neighbors, the elderly. Be kind and be patient. When we give COVID reporting information, we are always asked about recovery numbers. We receive our information from the Virginia Department of Health, and they do not follow up or track recovery numbers like some states do. We have pressed them on this, but they state it's not in their role. However, some citizens look at the information that has been given from a positive standpoint, and I would like to explain on that. In our positions up here, when making decisions regarding public safety and health and people's lives, we have to analyze facts and data. Others in the community can discuss the more positive assumptions and deductions like some of our community are doing. Some look at our death totals, 1 death compared to 65 people that have tested positive as of yesterday. An example of this, they look back several weeks when we were at 20 to 25 positive cases and assume since no more deaths have been reported, these people are recovering now or have recovered. This is a positive assumption and nothing wrong with that. The same assumption can be used going forward depending on number of deaths reported. That's why having an official recovery tally would be beneficial to data validity and local planning. Whenever there is a question regarding this virus, we lean on Bill here and his staff. He is the intermediary that communicates with VDH, the hospital, human services, and the rest of our community partners. He is our local specialist, and he has his go-to contacts on the state level that he confers with. We must trust these people to give us the information needed to make tough decisions on community protocols and public health. We know many of you are hurting right now. If our Board of Supervisor members can help, call us. That's why we are here. Brad Rosenberger, if you live in the Jefferson District, call Bill Chase. If you live in the Stevensburg District, Jack Frazier in the Cedar Mountain District, Tom Underwood in the Salem District, Paul Bates in the Catalpa District, Kathy Campbell in the East Fairfax District of the town, and myself for West Fairfax. Our Board of Supervisors and Town Council strive to have our businesses open back up soon as possible. They are the livelihood of our existence. We strive to open essential county services like the library and planning office, even if allowing a few people in at once. But we need to be smart, see the numbers level off some, and work together. I've lived in Culpeper all my life and have seen this community work with each other so many times for a cause or during a conflict. We need to work together in solidarity. Our local government, our business owners, our citizens, our first responders. That's one reason we are up here today, to inform you, to calm you, and to display our togetherness as two governing bodies supporting our emergency management personnel. If you are a Culpeper citizen, a business owner, or an elected official, we all are in this together and as one, a slogan in our community, and the mayor said it earlier. Right now is Culpeper Strong. Just like in the past, on many occasions when our community has come together as Culpeper Strong, as one, this crisis is no different. In closing, I would like to thank Director Ooten and Mayor Olinger for being here today and being involved in this public safety message. I would also like to thank John Krawchuk for being here, and Culpeper Media for making this telecast accessible to our local citizens. Thank you.